Good evening, everyone. Thank you for joining us. I am Representative Melissa Minor Brown, and I have Tiffany Chalk here with me this evening. Whether you are here live in the audience or whether you have joined us online, I just want to say thank you. We are here to talk about Black maternal health. The title of our panel tonight is Elevating Women's Voices, an intimate conversation about Black maternal health. Tiffany, you want to?
Thank you so much, Mimi. So I want to bring regards on behalf of the Delaware Healthy Mother and Infant Consortium, where I serve as a community health advocate, and I lead the Well Women Group and the Black Maternal Health Work Group. And my colleague here, would you like to tell them what groups you lead?
Of course. So I actually lead the Social Determinants of Health Working Group under the Delaware Healthy Mom and Infant Consortium, also the Vice Chair of Health and Human Services with the House of Representatives.
So thank you so much. So we would like to go into our introductions of our panel right now. Mimi?
Well, I think I just told you about myself. I represent the 17th District in Delaware, but you know, I'm here as a mom, as a nurse, as a Black woman. And I actually brought my best friend with me today. Her name is Amanda Mosley. I've known Amanda since I was 5, and Amanda's going to share some of her experiences that she's had during this Black maternal health epidemic.
So we have Dr. Marshall Lee.
Hello, hello. My name is Dr. Marshall Lee. I am a family medicine physician at Christiana Care. I am also the director of the Harrington Trust, and I am a proud member of the Delaware Healthy Mother and Infant Consortium. It is a pleasure to be here. I'm so thankful for the opportunity.
Thank you for being here.
Miss Cynthia Guy.
Hello, my name is Cynthia Guy. I'm a licensed professional counselor of mental health, a licensed master social worker, and I'm also a certified clinical trauma professional. I work at Christiana Care in the Women's Department as a behavioral health consultant, and I'm the owner and founder of CLG True Solutions that specializes in emotional wellness workshops. Thank you for having me.
Thank you so much.
Thank you for being here.
So some people want to know, like, why are you doing this event? Like, Tiffany, you've been doing this work for 14 years. April always keeps me on target of how long I've been doing this work. But I myself experienced some adverse outcomes with my own pregnancies over the years. And I've been a part of the DHMIC. You'll hear us say DHMIC. That is actually the Delaware Healthy Mother and Infant Consortium. I've been doing the work for almost 15 years now. And you want to know why? Because Black maternal health is a public crisis. I'm going to say that again. Black maternal health is a public crisis. And if you didn't know, I'm sure you'll learn after tonight's event why it is a public crisis, why we all need to join together, because we are stronger together to make an impact throughout our state, statewide, so Black moms and Black babies have a chance at life. So right now we want to just take a moment to share some of the statistics in our state. The U.S. mortality rate says 3 times Black women are twice as likely to suffer from life-threatening pregnancy complications. Trends are similar here in Delaware. The disparity gaps remain stubborn, persistent, despite our efforts to move forward. What needs to happen, Mimi? I know you say grassroots community-driven approach led by Black women is one thing that needs to happen.
Yeah, and you know what, Tiffany, I think it's important to also note that one statistic that we don't talk about enough, and it's that Black women, a Black woman with a college degree, a Black woman with an advanced degree is more likely to die during childbirth than a white woman with less than a high school diploma. And we have to ask ourselves, why is that? And that's data, right? And one thing we know is that data doesn't lie.
Not at all.
That's what the data says.
It does.
So we need to do something because Black women are dying, Black babies are dying, and the data is proving that.
It is. I like that you noted what the data proves, because a lot of people tend to believe that it's just in our inner city. It does not matter your social economic status or not. Mothers are dying. And now we want to take just a moment of silence for those wonderful moms who are no longer here with us.
Yeah, I think it's important to start off with a moment of silence to just remember the women that we've lost due to the Black maternal health epidemic as a result of preventable complications And I'll mention a few women's names, but that's only a few, of the hundreds of women who have lost their lives due to negligence. Dr. Shanice Wallace, Shamani Gibson, Yolanda Kadima, Syasia Washington, Kiera Johnson, Dr. Shalone Irving, and there's so many other women. So if we could just take a second and just offer a moment of silence for those women. Thank you. So I'm just going to jump right into some questions.
Right on ahead.
And of course, I'm going to just ask Amanda some questions because you're my best friend and I can. But we talked about some of the statistics related to Black maternal mortality. And I just want to know, does any of that stand out for you or to you?
Absolutely. It's just unfortunate that it's 2022 and this is actually a thing. But it's just something that I can relate, something that my family and friends can relate to.
Mm-hmm. And it's sad because there's so many Black women in the audience who can also relate to it. I know I've had complications twice as a young teen mom, and then again as a master's prepared registered nurse. Same issues, same bias. And I kind of want to talk about Sophia a little bit. In 2019, what happened?
In 2019, I was pregnant with my baby, Sophia. We started off with a normal pregnancy, and about my 25th week, I took my glucose test for gestational diabetes, and I failed it. Shortly after I was diagnosed with gestational diabetes. And long story short, at around 37 weeks, I had went to the doctor to have my twice per week non-stress test.
And I remember that day.
Yes.
Because that was a Tuesday and we were celebrating Juneteenth
Yes,
in the legislature.
Yes.
Because you came down right after your appointment.
I came down after the appointment, yes. I had some concerns because the stress test didn't come back normal. So they took me back to have an ultrasound. I was supposed to see a doctor. The doctor just blew me off, said, everything's fine. She told me that my baby was perfect. Later that day, I actually had another appointment with my OBGYN, and I told my OBGYN about the concerns that I had with movement with the baby. I was told that it was normal. I was even compared to his wife. Needless to say, 2 days later, I had a long day out with my family, and I came home, and something didn't feel right. I wasn't feeling my baby moving. So I had something to eat because they told me to have something to eat. Still no movement. So I decided to call the doctor. The doctor told me to come right in. Needless to say, my baby didn't make it. My baby was stillborn at 37 weeks.
And you actually woke up to them telling you that?
That my baby, I wasn't even all the way together, and I asked, where's my baby? And they were like, your baby died. Yeah.
And walked away.
And walked away. And that was it. And I had a lot of issues conceiving. I do have a 2-year-old, an 8-month-old. She would have been 2 years old. I have an 8-month-old, and I had some issues trying to conceive her. And once again, I was told that it was all in my head, that I needed to get out of my head. I needed to seek counseling, which I did, but it was something deeper than that.
And you didn't have the support that you needed.
No,
and
I didn't.
That Tuesday, when you came down the leg hall, we both said, that doesn't sound right.
Mm-hmm.
That doesn't sound right. But your doctor said, no, you're fine.
Mm-hmm.
My wife was fine.
Mm-hmm.
You're fine.
I'm fine.
Mm-hmm.
Right.
Thank you for sharing that story.
Thank
you
you
so much.
Thank you for having
sharing
me.
that story.
Thank you.
It's stories like that why we're here tonight. So during the evening, we may just take a moment to pause, right? Because it is stories like Amanda's why we do the work that we do. So next I would like to ask Dr. Lee a question. So what are your thoughts as a Black woman and a medical provider with respect to the responsiveness of systems of care to meet the needs of Black and brown women impacted by the maternal mortality crisis?
So each year, more than 700 mothers die from pregnancy-related deaths. That's 700 mothers that aren't able to hold their babies and and see their newborns grow into adulthood. That's 700 too many women. And as you mentioned, maternal complications are 3 to 5 times as high for Black women as white women. Some medical conditions, education, and income are protective factors, but as you said, Representative Mimi, is not protective for Black women. And as a Black woman, newly engaged, I hope to one day become a mother. But I'm terrified. I've had health challenges, was discharged from the hospital at 2 a.m. With shortness of breath, and had to return 2 days later to find out that I had fluid, 3 liters of fluid on my lungs. So if people aren't listening to me, a Black woman that's a doctor, I'm terrified of being pregnant in my most vulnerable state because I'm concerned about what could happen to me. And yes, we're doing a lot. At Christiana Care, we have a number of initiatives that are working to address maternal health disparities. We've made some inroads on hypertension, diagnosing mothers and providing them with extra care after they deliver to ensure that they are not readmitted for hypertension complications. With diabetes, we're working to do more things, but there's even more that needs to be done. And so as a health professional, I'm oftentimes apologizing. I'm sorry that you had that complication, and I'm even more sorry that the health professionals treated you that way and did not have compassion. And so I spend a lot of my day interacting with my patients, apologizing, but doing my best to rebuild that trust and letting them know that they have a firm listener in me and that I'm doing all that I can within the system to improve healthcare and that there are advocates within the system. We're doing things now, but even more must be done.
Can we get some tissue up here, please?
Thank you so much. So my next question, Cynthia, as a therapist, you see all kinds of people at their most vulnerable. Can you share a little bit about the populations of women you work with in your role as a behavioral health consultant?
Oh, yes. You've heard the song, I'm Every Woman, and it doesn't matter what version. We could do Whitney Houston, we could do Shaka Khan. Those are the ladies that I service. They are every woman, and believe me, it's all in them. They are mothers, they're daughters, they're sisters, they're aunts, they're caregivers, they're providers. Some of them are social media influencers, fashion moguls, dancers, I mean, a gamut of things. But a certain point in time in their journey of maternal health, they hit a crisis. They get disappointment. They experience grief. And they start to lose hope. They start to lose trust. And what's most important is we need them to find their voice again. You know, they need to find their voice. And that's where, as a behavioral health consultant, we try to step in to be that agent of hope, to be a professional that they can trust, and to help them, most importantly, find their voice again.
Thank you for that. So do you find there's adequate mental and emotional health resources to address the needs of women, and especially pregnant women? Because as we know, the data says, especially with Black women, I believe, don't quote me, it's somewhere between 40 to 50% of Black women who do eventually die from, maternal mortality, that there is some mental illness or something in the mental space that they are dealing with at that time.
Yes, that's a great question, and it's a tricky question. Both of you are on committees, and I'm on your committees, Social Determinants of Health, the Black Maternal Women's Committees, the Well Woman Committee, and it's a tricky question because when it comes to mental health and emotional wellness, there's like different facets, right? So we can have agencies and programs, community programs that are doing great work. They have great resources out here. But sometimes with the resources, we're looking for expectations that will produce an outcome. So a lot of times we're focusing on that social determinants of health because it's tangible. It's something that we can touch. It's something that we can measure in a short period of time. So it's like the saying that I love, you give a man a fish and he eats for a day, but if you teach him how to fish, he eats for a lifetime. So sometimes with these resources, we're giving them a fish. We're saying we have this community that's living in a dry food desert that needs some food. So we are going to identify, let's say 20 families, and we're going to give them some fish, and they're going to eat. And they do a great job with that. And that's only one part of mental health and emotional wellness. Then you have the other part, the therapy, the healing process, the journey. And we have great mental health providers. We have phenomenal Black and brown therapists out here doing the work. But the thing with therapy, it's not tangible. You know, and if you put that expectation on it, it's very hard to control it. We don't know when the outcome's gonna come. So then what I find the problem is giving those professionals the resources so that they can teach, so that they can coach, without putting a timeline on it. But, I mean, if it's not gonna happen in 6 to 8 weeks, it may not happen in 6 to 8 months, you know, but we need to be a part of these journeys. It doesn't stop, especially when a woman delivers a baby. It doesn't stop after they deliver the baby. Or if someone miscarries, that doesn't stop because now the pregnancy is over. So I feel as though there's a gap, and that's what we have to start addressing, the gap of the resources between the social determinants of health and the therapy. And what's exciting is what we're doing right now, this forum, the advocacy, the sisterhood. That's what's exciting. That's what excites me.
Right, I see that. Your face lit up when you said that.
Yes.
Thank you so much for sharing. So I'm gonna move on to my buddy over here, Representative Melissa Minor Brown. So if you could share some of the legislative opportunity that's being addressed right now within our state as it pertains to Black and infant mortality crisis.
Sure, Tiffany. But I want to just kind of piggyback off of what you said, Cynthia, about addressing those gaps. You know, the social determinants of health that exist in our state, we can't just, we can do 1,000,001 pilot programs, you know, to get the research, but we know what we need.
Yes.
Right? We know what we need. And when you talk about social determinants, yes, we need to make sure that every Black woman, every person, you know, that they are able to thrive in an area with clean air, clean water, access to healthy food, access to quality health care. Housing,
yes.
You know, appropriate housing. You know, children should have parks to play in. You know, you should be able to, you know, go out and take a walk in a park, a clean park. But we also need to talk about that one social determinant that is difficult to talk about, and that's racism.
Yes.
Because that does exist.
Yes.
And it drives me nuts when folks say racism doesn't exist. Slavery was back then. No,
You
it does
alive.
exist. It does exist, right? And
It's alive and well in the
It's
earth,
alive
in
and
the state
well.
of Delaware. Do not be fooled.
Right.
I have experienced it firsthand through my maternal journey and others as well.
I
Don't
have
get me
too.
on that,
My
please.
kids have, you know. So I will talk. I mean, other than working with the social determinants of health working group and chairing the doula working group under the Delaware Healthy Mom and Infant Consortium, I did just file the 2022 Delaware Momnibus.
Yay.
And I'm excited about this series of bills.
It's something to get excited
Yes.
about. I don't want to cut you off, but
I
I'm
know,
so excited about this bill.
I'm excited. And before I even jump into the Momnibus, I have to recognize my right hand over in the Senate, Senator Marie Pinckney, because she is on every single one of those bills as a prime sponsor or a prime co-sponsor, because she gets it. You know, she's also doing this work around Black maternal health. But
Thank you so much,
yes.
Senator Marie.
Senator Pinckney, can you just stand up for a second? So everyone can know who you are, please.
Thank you so much.
Thank you. I like to call her my partner in crime, but since we're both the chairs of the corrections committee, we
Can't say crime.
Yeah, we stopped saying that. So there's a series of 8 bills, and I'll talk about those bills real quick, and then I'll talk about the ones that are coming in the 2023 Momnibus. But in the 2022 House Bill 234, it expands Medicaid to 1 year postpartum. Because it currently cuts off at 60 days postpartum, and that's just not enough time for a woman to recover, especially to maintain her health care and to also seek that mental health care as well. Sometimes, you know, we've seen, studies have shown again that sometimes you don't even recognize that you're suffering from postpartum depression until you're at that year mark. So it's important that these women have coverage. Also, we talked about the hospital and being let go at 2 a.m. I remember going to the hospital 4 times via ambulance and being labeled a drug seeker. And I had something called a pseudotumor cerebri, but no one took the time to listen to me. The one bill mandates implicit bias training for all hospitals and birthing centers, for every employee in the facility, not just the doctors, not just the nurses, but even the janitor, even the greeter at the front door, because your experience starts when you walk in the door.
It does.
So everyone needs to know how to treat people, you know, and it's the folks that are like, I don't have bias. You just never know. You know, you never know until you take the time to understand exactly what that looks like. There's another bill that actually exempts pregnant and postpartum women that have a child under 6 months from TANF work requirements. So if a woman is receiving temporary assistance for needy families, such as cash assistance, most times if you're not working, you have to prove that you are out seeking employment, and there's a certain amount of jobs that you have to look for per week and then turn that in. So this would exempt that woman from having to do that, because I'm sorry, but at 9 months pregnant, you should not be out looking for a job and having to turn it in. That's very stressful. But there will be supplemental materials such as some modules on breastfeeding and safe to sleep, and some parenting groups that the women can, and the dads as well, can join during that time. Let's see, so we also tasked the Division of Medicaid to come up with a plan to reimburse doulas via Medicaid. That's really important, because every woman should have access to a doula, and we've seen how the use of a doula has improved outcomes, especially during the Black maternal mortality epidemic.
Well, let's stop right there and talk about why it has improved. So I think we can address the fact that Black women don't trust the hospitals where there's more home births, there's the doula support and the midwifery support that comes, gives them a sense of hope and trust that their birthing team is there to support them and be there for them, which ultimately would have them have a great outcome rather than an adverse outcome.
Yes, because that doula or that midwife is their advocate.
Yes.
You know, and the best part about the doula is that they prepare you for when you're walking into that doctor's appointment to say, these are the questions you should ask. And if your doctor doesn't listen to you, then this is what you do.
Yes.
So many people walk away feeling hopeless. I thought I had an issue. He's telling me I don't. His wife didn't, so I don't. Right. that doesn't work. Right. We're also making some changes to Department of Corrections policy around shackling pregnant women. You know, I've heard stories about pregnant women tripping over their shackles at 34 weeks pregnant. Well, why are we shackling a 34-week pregnant woman?
Where's she going?
Where is she going? I'm sorry. And we've already done the research. They haven't tried to go anywhere. So we don't need to shackle a pregnant woman. And when they go out to their appointments at maternal fetal medicine, I mean, how dehumanizing is it to walk in shackles? Shackles around your wrists, shackles around your feet, come on. And it has a mental health impact as well. And we won't be shackling postpartum women either. We also are incorporating a doula and midwifery program within our Department of Corrections, so that women will have access to a doula or a midwife while they're incarcerated. And we are also, this is in the embryonic phase, but we are working to ensure that the women who are currently residing within Department of Corrections that would like to become a certified doula will be able to have access to that program. So that, because these women will be released from prison one day, and they can be the person that gives back to the next woman who's relatable to them. Let's see, we are also removing the prior authorization. Well, actually, so we have a bill that basically ensures that women have access to blood pressure cuffs who are high risk. There was an issue where women that had fee-for-service Medicaid were not able to receive a blood pressure cuff when their doctor ordered it, who were high risk. And we know that Black women are there's already a higher risk of getting preeclampsia. So you should not have to get a prior authorization, and then you would have to have some type of pre-existing condition like high blood pressure. Well, I didn't have hypertension when I had preeclampsia. So that woman needs that blood pressure cuff. So we're removing that prior authorization. And then we're making some significant changes to the Maternal Mortality and Review Commission to look at the makeup of the commission so that it's more diverse. Also ensuring that socioeconomic factors are included. We want to know these women's zip codes. We want to know these women's race and ethnicity when they passed away or had an adverse experience. And also to ensure that they have public listening sessions so that they can listen to the public's advice and concerns related to maternal mortality and infant mortality. And then we are working on some things for 2023 under the African American Task Force with the Health and Welfare Subcommittee, so that we can ensure that there is funding allocated to Black maternal health initiatives, specific funding allocated to Black maternal health initiatives, so that we don't have to say we don't have the funding. And this funding will be allocated every year until the disparity no longer exists.
Okay. Awesome. Thank you so much, and Senator Murray, for the work that you're doing on the legislative level to change, make an impact in our state. So I want to take it back to Dr. Lee for a second. I want to know, are there opportunities you see from your lens to improve care delivery, and what might that look like?
Yes, that is the good news, is that there are a number of opportunities that exist. I'm so excited and hope that everything passed, because many of the things that our representative has mentioned, I know will be effective. Oftentimes we focus on when a mother is pregnant, and we know that the pre-contraceptive as well as the postpartum period are also very important. And if women don't have health insurance or access to health care, you can only imagine the medical conditions that we could have picked up earlier and addressed prior to pregnancy. So I'm super excited and hope that those bills pass. We also need to address all of the upstream effects and causes of inequities and social determinants of health. You mentioned many of them: housing, mental health disparities, the chronic health disparities. But the elephant in the room is bias and racism. And so oftentimes we look at the gap and we put an X, we can't account for that gap. We know that the hypertension disparities, the chronic disease disparities, the social inequity disparities do not account for the gap in maternal health disparities. So what is that gap? It is the elephant in the room, racism. And training is great, but we need to clearly monitor and evaluate and ensure that our efforts are making a difference. And I do a lot of work with working on the diversity of the workforce. Unfortunately, Delaware, like much of the United States, has shortages in healthcare. And even more troubling are the shortages in minority physicians and other health providers. Black doctors only account for 5% of the health workforce, and we account for at least 13% of the US population. And so, yes, you can do training, but ultimately you have to change the heart of our providers and ensure that they're listening and that they'll be held accountable if they're not providing equitable care for their patients. So yes, there are a number of things that we can do. As a system, I'm super excited. I know our leaders are invested in improving the maternal health disparities, but we also have to work with our community members. As a doctor, as a researcher, like I come up with some great ideas, but I know that in order to make them successful, we have to collaborate more with our community members and ensure that their voice is heard and that we're meeting their unique needs.
Marsha, thank you for the work that you're doing. I mean, you're doing great work. You are, first of all, you're a Black doctor and you're a woman in the profession. There's not even many women in the profession. So, I mean, that's like it's a triple whammy, you know, so I'm just so thankful that you're here because we need you.
And I have to give a shout out to my colleague because I can't do it on my own. My colleague, Jackie Ortiz, in the Office of Health Equity.
Yes.
Thank you.
Thank you, Jackie.
For your friendship and partnership.
Thank you, Jackie.
Thank you.
So I have a question for you, Tiffany.
What is that?
Now, how long have you served on the Delaware Healthy Mom and Infant Consortium?
14 years.
You've served 14 years as a governor-appointed committee member to the Delaware Healthy Mom and Infant Consortium.
I have.
You have, and you see the disparities. You know, you see that the numbers aren't getting better. Black women are dying every day. But why do you remain so committed to this work? Because I know it has to be discouraging at times.
It is. So I'll take it back to, well, I'll never forget the day, March 4th, 2003. I walked into the triage at Christiana Hospital. I was a little shy from 24 weeks gestation. I had been having back pain, and I laid in that room in the triage for 4 to 5 hours, and no one saw me, right? I ultimately gave birth the next day, March 5th, to my son, Jared Michael, who lived 28 days at AI DuPont Hospital. And from that day forward, I said, I never want any family to experience what I experienced. When you're told your baby's not gonna survive, we can go through the measures to basically abort your baby. And I says, I will never, ever make that decision. I will not live in trauma and coulda, shoulda, woulda. I will have this baby and it will be what it be. He's always will have a special place in my heart. So from that day forward till the day I die, I will be in this work because I never want a family to experience what my family experienced through my loss of Jared. Now, I've had losses after Jared, but the difference is now I'm on the DHMIC. Now I have support of some of the colleagues from DHMIC, Dr. David Paul, Susan Noyce, people who are advocating for me because I didn't know how to advocate for me. You know better, you do better, right? So I'm at a stage where I now know better. And I just never, the heartbreak, the trauma, when you go to your 6-week checkup after you have a baby and everyone in the doctor's office says, how's your baby? Oh, my baby that died last month? And your doctor sends you out with a bag of Zoloft? Yes. That's why some things I always say you can't talk me out of. You cannot talk me out of how Black women are ignored. You can't talk me out of the racism and the racial disparities that are in our healthcare system as a Black woman. That's why I will always do this work. I get very passionate about it. I get very upset, right, when people don't get it, because I feel like if you get it, right? And you know better, you do better. So I want everyone to know. I want every Black woman out there to know you have a voice. We want to hear your voice. Your voice matters. Your health matters. No matter what the doctor says. You know what? You want questions? I don't care how many they get. Go get me another doctor. I need you to answer these questions because I'm not leaving this room until you answer the questions. That is the boldness and the tenacity that we must have as Black women in taking ownership of our health care and the health care of our families to really make the change. See, I get so hyped.
Speak it, Tiffany.
Yeah, because it's real for me. It's real for my family. I have other people who have experienced miscarriages, infant mortality, stillbirths, right? And they leave the hospital feeling like they're worthless, they're nothing, like their womb is empty. And there's something about an empty womb that brings trauma and affects you in the mental realm, where these women need to know like they have the help and the support of people like everyone here, everyone in this room. I'm sorry.
Ooh, you know what? It's tough being a Black woman.
Yes.
It's tough being a Black woman.
You know what? Because we're strong, right? We're always, you know, like sometimes I even have to feel like I have to dumb down. I'm in these meetings and Tiff, you can't be too loud, you can't get too hyped, you can't be too passionate because this angry Black woman,
like
right?
you're an angry Black
right?
woman.
So then we're so strong, right? So when we're in pain, Kira Johnson, right? Her husband, when they told them something's not right. Serena Williams, you know, I hate the fact that Serena had to go through what she went through, but because she's the stature and the celebrity that she is, it was allow people to listen and put an ear to stuff we've been talking about for years, right? Because she's strong, she's a strong athlete, and she's like, something's not right. Black women, when you feel, you know, we know our bodies, right? Yes. When something's not right, scream it from the rooftop. It ain't right, y'all.
Yeah. It's crazy because we talk about the strong Black woman and we're forced to be a strong Black woman. We don't always want to be the strong Black woman.
No. Yes.
We don't always want to.
Damsel in distress me, please.
Yes.
Help me. Yo, my husband knows I will be the damsel in distress. Somebody help me, please. Yes, thank you. Yes, you can get that bag.
Yep. Thank you so much for your commitment to this
You're
work,
welcome.
Tiffany. And you're the right person to do this work. And
Thank
I'm
you.
so happy that we're able to share this work with you and be able to get to a point where we can change the perception,
Yes.
change the mentality,
Yes.
close these gaps.
Close them.
We're such a small state, and we rank 28th in the nation for infant mortality.
Oh, for maternal mortality.
This is
we're
for infant
top 10,
mortality.
right?
Oh, yeah. And it
Top 10.
continues to rise.
Top 10.
We're such a small state.
So
We can do so much.
So as you said, it does get disheartening. But I look at all these faces in this room and those who are out there in TV land, knowing that there's somebody out there like me, there's somebody out there that may need hope, there's somebody out there that may not know, right? So that it just fuels my passion to continue the work. So you guys are stuck with me. Y'all, I'm gonna be 70 talking about, do you got a doula, right? My friends call me the healthy mom, healthy baby police, right?
No, when you're 70, you're gonna be like, remember when?
Right.
Because we're gonna be in a better space.
Yes,
You're gonna be like, remember when we had to fight for Black women?
Yes. Because
Yes.
change will come. We just got to keep doing the work and being consistent in what we do and not be afraid to be that voice, to be that agent of change.
Exactly.
Yeah. What else you got?
I don't know. I was thinking maybe we should turn to the audience.
Yes. How about that?
See if there's any questions.
Yes. We're going to turn to our audience now. Don't be shy.
Don't be shy.
Any questions? Even if you want to share anything,
Share a
did you
story.
learn anything, like anything that has resonated with you that one of the ladies on the panel has shared, please.
My favorite senator.
Hey y'all,
Hi.
Representative Minor Brown, Tiffany, and all of you beautiful Black women sitting up there, thank you. Thank you for creating and making and enforcing this space that we talk about Black women and the issues that Black women face. Much like you, Dr. Lee, I do hope to become a mother one day, and I'm scared. It's scary. But one thing that I would want to do is, as we're talking about these issues, I want us to remember that there is no more joyous person on this earth than the Black woman. There's no more beautiful, brilliant, amazing, capable person in this earth than the Black woman. And so I was wondering if y'all could just talk a little bit about the joy that comes from and with Black motherhood. And that doesn't even have to be biological motherhood, right? Because I'm an aunt. You can't tell me nothing about being an aunt, okay?
Yes, yes.
And I get to send them home every year a little bit. So can you just tell us a little bit about the joy that comes with that, whether it's biological, familial, friend, best friend, baby, goddaughter, godchild? Can you just tell us a little bit about the joy that comes with Black motherhood as well?
That's a good question.
There's nothing like it.
Yeah, like I have an older son before Jared, and it's my pride and joy. You know, being a mom, being an auntie, right? I love all my nieces and nephews, and I feel like it's a pride that I carry in my chest to say, like, I'm a mom, like I'm a Black mom, and I've nurtured, you know, my son had just turned 30 last month, right? I nurtured this now wonderful young man, right? And I was able to do that even starting out, being a single mom at that. You know, let's talk about that. Love my husband, haven't been married, you know, 20 years this year, and he came in at a very pivotal time in my son's life. And we have a great blended family, but even the pride that I carried even as a single mom, because even in my pregnancy, at the age I was pregnant, I always knew, like, I have it in me, right, to do this, right? I'm gonna raise this young king to the best of my ability, and I just carried that pride with me through everything I did through my journey as a mother, and I still do. God, kids, aunties, babies, everybody. It's just a joy that comes with children. It's just such a joy for me that comes with them.
It is a joy, and I think that's why we say pregnancy, birthing a baby should not be a death sentence for Black women.
Exactly.
And right now, like you hear Dr. Lee say, I'm afraid. I'm afraid. But I will talk about the good stuff. Of course, everyone knows Zachariah, right? Zachariah is all over the place, right? And then
Social media famous.
He's social media famous, and there's his auntie right there. She was the first person that actually came to the hospital when I had him on Thanksgiving, bringing me Thanksgiving food. She was like, you don't have to eat the food at the hospital. She brought me some food. I had my own little turkey though, so I was happy with that. But I have now taken on that role as auntie. I talk to her every morning. I FaceTime with her baby because I can't be there with her all the time because she's in another state, so I make sure that I FaceTime her every morning so that she will remember who I am. I made sure I talked to her belly when she was pregnant so she would recognize the voice.
And she knows.
And she knows, because when I have her, it's just like we haven't even been apart from each other. But there are joys in it, and I think the one thing that we do as moms is we just want to nurture our children, we want to pour into our children, and we just want them to have better experiences than we've had.
Yes, that's it right there. Yeah. Anyone else want to share?
Well, I'll share.
Okay.
I'm not a mother yet. I've had struggle with my own journey, but I am a proud aunt, you know, and I have my gummy bear and my Nutter Butters, and, you know, I have a lot of nephews, only one niece. And today I woke up this morning super proud because I have a godson, and today's his birthday. He turned 20, and I was in that delivery room. I was at Wilmington, at that time college, for my master's degree, and I got that call. And I hightailed out of there like I was the father. And I was in that room 20 years today. And it's just such a joy when I see all of them, you know. And when I walk into the doctor's offices that I serve, although I have my own challenges, the love that they give me when they bring the babies back, when they bring me pictures, it's just such a joy that it doesn't matter what your journey is. It's always great to support the other woman's journey as well. You know, I have a colleague, shout out to her, she's not here, her name is Jasmine. She is a fellow BHC with me, and we call it Black Girl Magic. We're like, all right, girl, with that Black Girl Magic. We say that every day to each other, all right, Black Girl Magic, what you doing today? So it's just a joy to be a part of somebody else's journey, to be an aunt, to be a godmother. It's just, it's nothing like it. It's nothing like it.
You know, I like that you said Black Girl Magic because I don't know about you all. I do, but I'm going to let you respond. But doesn't it feel good when you have other Black women that support you? You know, I just was saying this to Senator Pinckney earlier. I think I said it to you yesterday too, because, you know, I actually walked into work. I had a bad hair day the other day, and one of my colleagues ran up and she was like, "Oh, here you go." She took a pin out of her hair, put it in my hair, took some gloss, put it on there. She was like, "There you go." And she turned me around and she was like, "See?" And I was like, "Oh my gosh, I feel great." But it's just that empowerment that you get from your sisters, you know, whether it's the auntie role or just the sister role. It's just a good feeling when we just empower each other and we support each other. You know, that love, you could just feel the vibe, that love just pours into you, and I love it. And I want to thank all of you because I get it from all of you too. And my folks out in the audience as well, like April Lyons and Senator Pinckney. And there's one more thing I want to say though. I want to recognize the males that we have in the room because
shout out to the males.
We're the strong Black women, but we're thankful. We cannot forget about our men. We cannot forget about our Black men who stand there by our side and support us through this. CJ, thank you for the work that you're doing. You're a single dad, CJ. You're a single dad. Thank you for the work that you're doing around Black maternal health. And JJ, he's hiding somewhere. But and JJ as well, the work that he's doing and the work that they're doing in Senator Coon's office to support Black maternal health and Black women and Black infants.
Well, I just want to shout out my husband really quick because I just had this conversation with somebody that Tiffany Chalk would not be able to do the work that she does if there wasn't for James Chalk. So I would be remiss if I didn't acknowledge him, because though this is a volunteer job for me, some weeks I'm working at like a full-time job, like I'm getting a nice check, y'all, because I'm that passionate. And he allows me, right? And I say allow because it's a partnership, right? Like I know who I am and I'm strong in who I am.
Because you know that was a red flag word when you said that,
I'm
right?
gonna deal with that, right? So, but he affords me the opportunity to do what I do because he wants me to do it in excellence, and he's very passionate about it in the same token. So yes, shout out to JJ, CJ. I love how CJ jumped in when he first found out about it and was like, I want to learn more about this Black maternal health. How can I get in and help? So thank you for acknowledging the men.
Yes, and CJ actually did some work with Black Breastfeeding Week.
He did,
right?
Black Breastfeeding Week, his organization, The Connect. They are hosting an event next week that we'll be sharing on social media, so look out for that as well. Question.
Yes, question. So I heard some really dynamic dialogue between all of you, so this question is for everybody on the panel. I remember going to the DHMIC conference in 2018 where Dr. Trujillo was there. Dr. Trujillo was from California, and she worked in maternal child health. And one of the things she said that stuck with me was that she was the only Black executive director in the state of California that led the organization for maternal and child health. So my question to everybody on the panel is, how important is representation in the space of maternal and child health?
Oh my gosh. I'm just going to start by saying it's extremely important, but it's crucial. And it's crucial on every level. The executive director, the person in the community, the grassroots organizer, the community mom, the community grandmom, the single dad. It's important for everyone on every level to be a part of this, because that's the only way we're going to get this work done.
I agree.
It's crucial.
I agree. Anybody else want to share?
Well, I want to say thank you to Ms. April Lyons, because when I went to one of my first many DHMIC meetings, she was there, smiling, welcoming me in, didn't know who I was at all. And when she found out more about the things I was doing in the community, at that time I had did a community service event where we rented out a laundromat, myself and my sorority with Dr. Gorton, Brandywine Women's Health at that time. And we was giving out for Stubbs Elementary School for them to come do their laundry, as well as haircuts, barbecuing. I think I hosted about 2 or 3 of those. She found out about that, and she said, you got to start telling people what you're doing. People have to know what you're doing in this community, because a lot of times, honestly, as Black women, we dim our light. We don't shine the light on ourselves. or blow our own horns to say.
Yes.
You know, so it's very important to have us in these positions to have representation there, but the representation could be there, but sometimes you just don't even know it. You know, I know I'm a quiet bird. I can let loose and be loud when I need to, but
That's called the quiet storm.
Yeah, sometimes you don't even know I'm in the room, you know, so I think it's important to always share a light on each other, as well as to not be afraid to shed a light on yourself and on what you're doing.
So true.
And my sister mentioned sisterhood. She's a proud sister of Alpha Kappa Alpha, and I'm a proud sister of Delta Sigma Theta.
Yes.
Oftentimes we compete, but we're competing to do the work in the community, and it's nothing but love. I would like for you to check out Empowering Our Sisters, which will be on the 23rd of this month, because it takes us all to do this work. And I have to give a shout out to my fiance. Y'all are trying to get me in trouble. Jason McCall, thank you for your support, baby.
Question?
Yes, ma'am. This has been wonderful dialogue. One of the things that I have noted in my work is that it's difficult to reach the people that need to be reached. So getting the information to the population that we're trying to affect has been an issue. So my first question is, what resources do we have to get to the population that we're trying to get to, those most vulnerable folks, because they may not know that there are these resources or that there are these programs. So how do we get to them? My second question is, in my own personal experience, having had a poor outcome with birth, I did not, and I'm a healthcare professional, so I didn't realize that I had postpartum depression until very late in the game. And I denied it because I'm like, I'm the strong black woman. There's nothing, I mean, I can brush this off. So education on all levels is paramount to addressing all of these issues. So my second question is getting the information to those people who may even actually have it or may not even know that the education, they may not even know that they have issues. So I think that.
So I can address the first part to your first question, because I know through the DHMIC we do have our community health workers and our health ambassadors who are on the grassroots level in the community disseminating some of that information. So even if you want to continue that dialogue offline where we can connect you with the leader of our community health worker program, I would be happy to do that. Because I think to reach, and it speaks to the representation, right? So the community health workers, they're in the community, they're known in the community, people know them and they trust them, so they're more likely to receive the information in the manner that we want them to receive it to make an impact in their care.
The trust piece, that's so important.
Yes.
Cultural competency,
Yes.
cultural awareness is so important. Also, to piggyback off of the first, Tiffany's response, you know, the work that we're doing on the DHMIC, I'm going to talk a little bit about a pilot that we're working on for homeless pregnant women. So just some of our most vulnerable women in our state, we are actually I call it like unpacking the backpack, because this woman comes in and she's homeless and she's got a backpack just full of stuff, right? Like, and I don't mean physical things. I'm talking about the barriers that exist in her life, the rackets that never got addressed that continue to show up every day, why she's homeless. So with these women, we are working to get these women to housing. And with that housing, it's a pilot that's going to go on for a little over 2 years. And with that housing comes all of the resources as well, the wraparound services, the education piece, the financial piece to ensure that that she doesn't have to worry about paying that rent every month. She has access to education, access to the mental health resources so that we can address those barriers that got her to that vulnerable space, but also to improve our infant mortality rate and maternal mortality rate in our state. So, we just slowly begin to unpack that backpack and help her address those issues one by one. And I'm really excited to do this. We actually just started rolling it out for our homeless pregnant women in our state. So they will get those resources. If a homeless woman walks into one of our shelters and she is pregnant, or if she walks into one of our providers' offices and she is pregnant, and we're starting in Newcastle County, and then we will expand. But we will take that woman, we will wrap our arms around her, and we will unpack her backpack, help her unpack her backpack, and that will, our hopes are, and I believe that it will help her get to a point of sustainability after that 2-year mark.
And COVID-19 has taught us that we have to get outside of our comfort, and oftentimes we want to remain within the hospital walls and do our work there. And people say that this work is hard. It's actually not. It may not be as glamorous. It may take a little bit more time, but it's doable. COVID-19, we were knocking on doors. Shout out to my friend Daryl Chambers and the CIT team. You have to go door to door. We were standing in parking lot disseminating information, passing out PPE. If you want to reach the community, you have to go to the community. You can't expect them to come to you. And so it's important that we have representation at our tables, but that we go to their tables as well and build that trust.
Thank you so much. Any other questions?
I just want to thank you for all of the wisdom that you have imparted tonight. I think you touched on so many topics that are very important in this space. And I wanted to go back to the mental health topic. Historically, looking at the dismissiveness of Black women via the tropes that we see, the Jezebels, the Sapphires, the Mammies, we have been historically represented and put aside, cast aside. And so I want to know what things are we doing in that mental space to increase those workers in that area, healthcare professionals in that area, and get women that are having problems with postpartum depression or even depression while they're pregnant. What are we doing in that space?
Well, one great thing that Christiana Care has started, and it started with me, is they started the behavioral health consultant role in women's health. And that is something that was never until I started the position in September 2021. And what that does is that puts behavioral health consultants in these doctors' offices, in the OBGYN offices. And we are that face and we are that resource that can connect you to other resources, such as things that I learn about through the DHMIC, connects you to, we have a great program, the Healthy Woman, Healthy Baby program in the state of Delaware, can connect you to the referral resources that they may have. We talked about the community health advocate. So it's great that we'll be in these offices and that we can go along your journey with you. Again, it's not just about if you're pregnant. You know, I've had a person that was 30 years old and found out she had to have a hysterectomy. And the feelings and the emotions that she had to go through when she was dealing with that. So it's just going to be a great experience. I have a colleague, Jasmine Hilliard, who's going to be in offices with me as well. So we're starting to be able to be in these offices, continue to be on these committees, continue to be in the community, and hopefully be able to engage, not just the doctors, because sometimes we know they're not engaged, but also, as we said earlier, the frontline staff, the front desk, the MAs, the nurses, and be able to just have a nice, safe environment for you to come in when you come to get your care that builds the trust, that creates the rapport, that will allow you to want to talk. Because sometimes I can go through a pregnancy with a woman, and then I find out when she delivered, she's been homeless the whole time. So hopefully we can keep encouraging them that they're in a safe place, that no one's going to call, DFS on you, no one's going to try to get you in trouble, but we can address these issues that you're dealing with. And not to be afraid to talk about it, not to be afraid to talk about, so many women have trauma, but they don't know it. They're so used to living with it. Right. So not to be afraid to talk about it so we can identify it. So I have to give a shout out to Dr. Matt Hoffman for when I talked to him, and he said, okay, that's what you want to do. And then Nicole Laporte, we got together and it's happening. And we're putting us in these offices. They're actually making me get my Pennsylvania license. So I'm going to be in the PA offices. And I'm like, okay, it's only one of me, but we're going to keep expanding. We're going to keep growing, and we're going to keep having this mental health representation in these offices, so you don't have to leave and go across the street. It's right there.
That's
you know
great.
what?
I was going to just ask, since the program is new, since you just started in fall 2021, had early talks already started? Because this is something that's very well needed, like to expand and grow the program.
Yes.
And if you don't mind me asking, is this a grant-funded program or not?
No,
because I just want to make sure it's still going to be around.
No, it's not, because I need my coin, so I was
Right.
like, hold up,
Okay,
now,
great.
I need to be, an
Right.
employee. So
Okay,
no,
great.
it is a position, and we're looking to create more positions
Great.
so that we can be here, and we're really looking to have that community engagement. So once me and Jasmine are up and running, we're looking to hit the streets. We're
Right.
looking to go into the Hope Center. We're looking to go into, the Boys and
Kingswood.
Girls Club, and we're looking to just be a part, because not only is it with the parents, but it's with the children, to keep these connections, these ties going, so that we can, when I used to work for Dr. Cecil Gordon, it was generations. There's people coming in there saying, oh, he delivered, me,
Right.
and now he's delivering my child. Now I'm getting them,
Right.
and now I'm helping them deliver their children. And it's just, you become part of the family,
Yes.
So it's really important that these positions are here to stay, so that you become a familiar face, a trusted face.
Great. Thank you so much for that.
I just wanted to kind of mention the postpartum depression screening that a lot of providers are now making a routine. It's so important to do your postpartum depression screening, but to continue to do it, not just at 6 weeks postpartum. We need to do it at 3 months postpartum, 6 months postpartum. Also, you talked about the children, and I think it's really important. There's one organization that does a really good job in our elementary wellness centers, because if we're going to reduce the stigma, we have to start with our children.
Yes.
So that they are not afraid to seek help when they need it. And so many times, and I'm going to talk about the Life Health Center really quick, because they have elementary wellness centers, and they use a universal screening model instead of a medical access model for our children to provide those behavioral health services. So it's not the child that is exhibiting the red flag behaviors and then, okay, you have these behaviors, so now you go to the wellness center. No, they meet with every child.
Yes.
Even the ones who don't exhibit those behaviors. And what we saw at Eisenberg Elementary was that, and I want to say that the behaviors at Eisenberg, they had behavior occurrences. It was like over 3,000 in like 2015, and then 1 year post the wellness center being there, it was under 200, because they met with every kid. And what we saw was that the kids who didn't exhibit the high risk behaviors were the kids that needed the most intervention. So it's important to reduce that stigma early and let our kids know that it's okay to have these conversations. It's okay to seek help. It's okay to talk about coping skills and just start to instill that in them early on, and hopefully we'll get to a point where seeking mental health or behavioral health intervention is not a stigma anymore. Right. But we did just vote a bill out of committee today to ensure that our private insurance companies actually I want to say it's private and Medicaid, that they do cover preventative mental health visits, because mental health screenings, because that was not even covered. People didn't even know that. So now that's a preventative, so you do not have to pay to have a behavioral health or a mental health screening. So hopefully, we'll get that out of the House and over to the Senate, and Senator Pinckney will make sure that we get that. Aren't you one of the prime sponsors on that bill? I think you are. We'll make sure you get that out of the Senate so that folks can have that coverage.
Yes, that's very important, because a lot of times, as the mental health provider, your hands are tied when it comes to coverage. So that a lot of people are wondering, well, why is there a lot of therapists that do private pay? Because a lot of people can't afford it. But also these therapists can't afford it when they're not getting the money coming in, because they're not getting paid to do these things, to do these services. So it's kind of a catch-22. So the more bills you guys can pass, thank you.
Just keep us in office.
If Mr. DETV would allow us, there was one more question that I really wanted to address before we do our wrap-up.
Thank you guys for all of the wealth of information that you've provided. I'm Dr. Leonette Collins. I'm here representing Dr. Doris Griffith from DAPI, Delaware Adolescence Program Incorporated. And so with all of the information that I've heard, I would just ask this question. When you have teen parenting mothers, and those who are still pregnant and expecting, a lot of what we're discussing, we're pretty much referencing that woman, that adult woman. I represent the children, the girls who had to become women because they became mothers or they're pregnant. So when it comes to the connectivity to resources that you guys are providing, the advocacy programs and the consortiums and things of the sort, I would be very interested in receiving information, and I would just ask that, you know, you keep our teen mothers, okay, keep our teen mothers, our parenting teens, you know, from high school, sometimes middle school, is when it begins for them, and they're still learning their bodies. Okay, and they become pregnant and they become mothers. So I would just ask that with all of the resources that you have, I want it all. I want to know, I want access to all of that so that we can take it back to DAPI and present it to our DAPI daughters, is what we affectionately call them, but present it to our students so that they too can have the same access that we as, and the majority of our population are minorities. So we want to make sure that we have the same resources and accessibility to the services. So please just keep us on your radar.
Oh my God.
Thank you so much.
Listen, we're going to exchange numbers after this, okay? I was a teen mom, okay? And you get me, okay? Debbie gets me. I'm coming in there as the teen mom.
Thank you. We would love to have you. Thank you so much.
Dr. Doris and I have had some conversations where we want to partner and do some educational events that are geared specifically towards teens. So it is coming, it is coming. So I will make sure that you are added to those correspondences as well. So thank you. We cannot forget our teen moms. I think it's very instrumental what she said, where a teen mom now has to walk into this role of womanhood, right? That they clearly may not be prepared for.
And don't forget, we talked about generations, you know? So sometimes it's generational, you know? So mom did the best she could, right? So she does not know how to be a mom, and she may not have been taught how to be that mom. I wasn't. So I know what that's like, but yes, I can't wait to work with our teens.
So thank you so much. This has been, I think, an excellent, excellent conversation. One thing that we do know that Black Maternal Health Awareness Week is just 1 week, right? It's always April 11th through April 17th, but the work never stops. So we are here to ensure that the work will not stop, that it will be our focus, not just for this 1 week. DHMIC, we have launched, last year we launched our Her Story campaign that you can find at herstory.com. I also want to share that our DHMIC annual summit, the flyer is on the screen, is coming up. It is on Tuesday, April 26th. Okay. Yes, it's a virtual event. April can be our cheerleader for this. She says it's the best conference that she ever attended. It's a free event. It's a virtual event. We actually will have a Black Maternal Health panel. Senator Marie will be on that panel, Dr. Lee, myself, and Representative Mimi. So if you do not know about that, you can go to dethrives.com to register for the summit. And we're asking for everyone here and everyone out there, if you are passionate and you want to see change happen within our state, join us in our work. Our subcommittees, you know, these are governor-appointed boards, but they're open to the public, that you can attend our meetings. Right now, we are meeting virtually, but if you would like to get added to our list for any of our committees, Black Maternal Health, the Well Woman, Social Determinants of Health, please visit dethrives.com. And I want to say a huge, big thank you to DETV. Yay! I want to thank you to my girls from A, B, and C who have been very instrumental in facilitating and managing logistics for this. The late night calls from our sidekick and biggest cheerleader with Mimi and I, April Lyons All. She's a great resource. When she used to be the DHMIC nurse consultant, and she was out in that community building those relationships, being a resource. So a lot of you are here today because April was that resource that introduced you to DHMIC. So I had to thank you, April. Don't talk about it later. So thank you so much. So I just want to leave you with what, Mimi? Close us out, please.
Listen to Black women. That's it. Listen to Black women.
Thank you so much. www.dethrives.com.